There's a big variety of things you can do in urology. A lot of it is in the clinic, preparing them for surgery, treating their symptoms after surgery. Some of the unique things are in the OR. That's probably the most unique thing for PAs in general. It's really awesome to be able to bedside and assist during the robotic cases.
You get to see the whole process. So you're there pre-op, you're there post-op. There's procedures to be done day to day in the clinic, going over results with patients and explaining what everything means. All the genomics that can be involved with biopsies is all stuff I've learned since I've started here.
We do robotic surgery, and I also see patients in the clinic and outpatient setting. What I like about my job is the relationship that I create with each patient. Every patient is so different and their needs are so different. Configuring what each patient needs, when they need it, when you could be there for them.
I knew I wanted to be a PA for a long time, since I was 18. And then I'm from Boston, but I've heard about Mount Sinai even being from another state. So I knew what a great hospital system it was. And then talking to Dr. Tawari, just his values on patient care, focusing on empathy, kindness, and respect is something that really drew me to working with him and his department.
I am the Vice President of PA Services. That means all-encompassing for every PA that works here. I oversee their HR, labor practices, compensation, but first and foremost, the advocacy of the profession in this healthcare system, focusing on culture, financial stewardship, growth, education, and a continuing career path for PAs here at Mount Sinai Health System.
It's been really rewarding to be able to work on the prostate bus. I've been able to see some patients out in the community and then follow through, see them here in clinic. And it's really nice because they don't expect it. Sometimes it's the first time they've had treatment in the United States. So it's really nice to be able to see them feel good to have treatment and have somebody care about them here, ultimately get what they need, that something they might not have even known they needed treated for or could be treated for. So
it's so many emotions, getting to hold their hand from the diagnosis through the treatment and then post-op. I feel so blessed to be a part of that journey and to help them along the way.
The Department of Urology here is one of the world's best. You get to learn from the best, work with physicians and other staff members that really do the most innovative and impressionable things for our patients, and you get to be part of that care team. Additionally, the PAs that are working in urology really do have a lot of autonomy. They hold their own panels, they do their own procedures, and we help them educate and grow in those areas as they become more and more of a PA in the department.
I started here about a decade ago, and at that time had no urologic experience aside from what I learned in PA school. And from where I started to where I am now, there's no glass ceiling. I'm continuing to learn every single day.
I feel like I've grown so much as a provider since I've started working here. The urology department is so collaborative, from the doctors, PAs, nurses, MAs, everyone works together so well, and I've learned so much from everybody. I feel like it's led to the best patient care, just that collaboration.
I've learned a lot. I've learned how to interpret biopsies, prostate biopsies, MRI specifically of the prostate, learning how to interpret exact scans, which is a kind of specific ultrasound we do here, and managing all of those results. It's been really amazing. I had no idea how many details go into prostate cancer, but it's been really a lot of learning, really rewarding so far.
Everyone is specialized in their area, and you get the best care in each sect with medical oncology, radiation oncology, preventative, holistic, diet, exercise, sexual medicine. We have a whole array.
Great place to learn. There's so many great surgeons in the department that are willing to teach. It's nice to work so closely with them in and out of the clinic and to see patients follow through from pre-op to OR to post-op.
I think it was this one experience I had when I first started as a new graduate PA here. We start surgery at 7 a.m. every morning, and I was going down to the pre-op area to grab the patient to bring it up to the OR. And I was telling his partner, his wife, okay, I'm gonna take him, we'll see you in a couple hours, everything's gonna go great. She was just at a very vulnerable state and grabbed me and just said, "You have to take care of him. I love him. He's my life." I know the patient's gonna be fine, but I saw how scared she was and how vulnerable, and she was putting all of her trust in me. And since then, every single time for the past 10 years, every time I see her and her husband walk into the office, We run to each other, we're hugging and kissing, and we always talk about that moment at 5:30 a.m. in the morning, 10 years ago. We created this bond since then.
I just feel so blessed to be working with such a world-renowned team of people who are giving me the best information and knowledge and getting to apply that to my job and helping the patients.